Thank you. So the first thing I need to say is that I am amongst experts here. And as I was saying during lunch, I know enough to be dangerous when I partner with the experts that we will hear from today. So what I wanted to do to start this conversation, and thank you for being here, is, as I said to Debbie, was to try to see if we can inspire you to actually think of healthcare as this platform where things actually are converging. There is a great intersection occurring nowadays in healthcare, and it's actually quite fascinating because as a designer, what I have learned is that we can bring that intersection to create innovation, to create new solutions, and actually that at the end of the day, as we say, everything is actually connected. Everything does matter, and everything is integrated to the point where what happened to us as a firm some years ago was that we started realizing that if we put designers and if we put other experts and if we put other practitioners in our firm that were not necessarily as knowledgeable about healthcare design, we were actually getting a very interesting set of solutions to very commonly known problems. And it was in this epiphany, I guess, that we realized that as a firm, and things will obviously be all jumbled up because of the system, but it says intersection there, that the intersection of a series of things actually led to innovation. Things like disciplines, practices, strategies, expertise, and research. And as a firm, actually, and as a global firm since the 1930s, these kind of practices have developed together with our healthcare expertise. As a global practice, yes, we're over 2,000 professionals, around 24 offices around the world and counting. We certainly want to commit to being a leading global firm of interdisciplinary design. And because of that, we believe that transformational design creates social and environmental well-being. Keyword well-being. So here we are in an intersection of a series of practices, of a series of disciplines, of a series of expertise, and we're creating all this research and we're writing all these papers. And what we realized was that the more we intersected, the more we communicated, the better our solutions were coming up. So we started de-siloing. And this de-siloing, you will see probably from our experts and how, as they speak in their presentations, you will see that that is also happening in healthcare as well. Architecture, branded environment, interiors, landscape design, outdoor-indoor relationships, even urban design, understanding how to design a city, were unquestionably things that we needed to bring to the idea of how to design a hospital, how to design healthcare of the 21st century. That areas of practice, all of our areas of practice in the firm, such as even K through 12, science and technology, civic and culture, higher ed, hospitality, as you will hear perhaps amongst the other speakers, were essential to the understanding of how healthcare design needed to evolve. For example, higher ed and K through 12. In K through 12, we do a lot of design in terms of passive security, or how to create environments that minimize stress for the younger kids. In hospitality, how to feel welcome, how to create a brand. In civic and cultural, to bring communities in, to engage them, to teach, to educate, to inform. So when we talked about strategies, we also started realizing that our strategies of high performance, or what we once called sustainability and we now should be calling environmental social responsibility, is about creating a hospital, as it says down in the quote, the hospital can situate itself in the ecology of its community and act as a force for healing. So hospitals, healthcare design, clinics, anything that had to do with well-being of the society actually becomes a catalyst. These buildings, these new areas are important for society now. They're engaging, they're communicating, they're actually educating. And as you can see, we're also talking about, in terms of strategies around, various practices, things that the primary mission being first do no harm. So we do that in buildings the way we do it in healthcare as well. As a matter of fact, the next generation of buildings we should be thinking of as buildings that are like a human being. They are bodies. They breathe. They need daylight. They need water. They need energy. They see, they breathe, they consume. So we need to understand that every opportunity that we have is an educational opportunity. So healthcare design needs to be also about the expertise of designing healthy and sustainable operations. Obviously, things like reducing toxicity, to healthy and local fuel alternatives, transportation alternatives. All of these working in synergy. Now, what is important also here is that, to some extent, there is a journey to wellness in the next generation of design and in the next generation of healthcare design. We are no longer just talking about green design. We're actually elevating that curve to regenerative design, regenerative buildings that heal. So that's the next generation of our designs. And as a firm, this is something that we hold dearly. We always try to elevate that. Design for us is transformational, is an educational tool. So innovation through research is actually something that is fairly embedded for us. So R for research is something that obviously not only informs our projects, but actually we use as platforms to educate around the practices, and internally and externally, because the bottom line is that sickness to wellness design is what we're doing. We're actually writing a lot of papers on active design guidelines, etc. And by the way, these are things that are across the board, right? So active design at workplace or in corporate design, active design in K through 12, active design in a lot of the hospitals that we're designing. And you can see a lot of the wellness strategies that we're dealing with in terms of material health, which is why we created transparency.com. You can Google that, where we were holding the industry of materials in construction accountable. We said, we no longer have to think that what we're building is actually healthy just because we say so. It's because it has to be that. So now building materials are also being held accountable. So there was a transformational moment in our firm, and that was that the day we saw healthcare design not as an expertise, but as a responsibility to build to better the human condition, we found our soul. And that was actually very important. That's why I like to speak about healthcare. Not the expert, but certainly the person who is there with a team trying to make sure that we are elevating and bettering the human condition, and that the soul of what we do is always present. So we determined that there were 5 very important big ideas we were going to have in our firm. And also 5 big ideas that we understood we needed to delve deep into, and that was going to inform our designs. And also that, as we posted in our blog, are things that we see are, no question about it, affecting how we see healthcare and how we design healthcare. And I think you'll see a little bit more of this. So I am just going to touch upon some of these generalities. You will see some of our guest speakers go deep into all of this. But these 5 fundamental ideas, again, have been very transformational, and certainly unequivocally something that we continue to go back to every day in all of our designs. First of all, one of the things that we're seeing a lot in healthcare design in our firm, and you'll see it in very different firms, is, healthcare is just very, very, how should I say it, diverse, meaning it's not just about hospitals. So healthcare right now is also about research, and it's about education, and it's about informatics, and it's about continuing or proactive health, and certainly about community engagement and community wellness. The global demand of healthcare professionals, therefore, has actually rocketed, and I'm going to talk about that a bit. We also know that learning is not about listening anymore, learning is about doing. These are some of the really, really huge trends in terms of education. Team-based learning, flexible learning environments. Education at the age of accountable care. This is no longer care and healthcare. It's no longer just about the doctors or the caregivers. It's about family as well. It's about how families are on the know, how they understand their family members' health, how to take care of it, how to prevent. And obviously there's the team-based everything. And you'll see some examples of how we're dealing with that, not only in the education of healthcare givers, but also in healthcare environments. If health is the aim, then healthy materials and buildings is the outcome. So this is going to be pretty much the outline of what we're going to discuss, and briefly I'm going to go through. So first of all is the global demand for healthcare professionals. So some numbers and some statistics. So there are 2.4 doctors for every 1,000 people. There are 3.0 hospitals, beds for 1,000 people. In the year 2025, there will be 19% fewer doctors than needed to provide adequate care for the population as it grows. And globally speaking, as some of you know, we're dealing with issues such as actually a growth and a demand for healthcare practitioners that is 3 times larger than what it is today. And we're certainly not providing that at the rate that we need to provide it. The global demand for medicine and allied health professions is exploding in certain parts of the world, as you know, specifically developing worlds. It is expected that this demand will be for over 3 times the normal number that we see today across the globe. And what does this mean to our ability to research care and enable practice through smart, sustainable facilities and enabling technology is still to be seen. We're trying to catch up. We're trying to understand what are the implications. And certainly you'll see in firms like ours that have been invited here, which are all global firms, you're going to see how in the world we're seeing this demand just happening at such a rate. We can't build enough schools of medicine. We can't build enough health sciences campuses. And they're getting bigger and more sophisticated and more complex. For example, we are currently building a school of medicine, actually, yes, it's a school of medicine and nursing, etc., all in one, in Kazakhstan, Nusam. It's the University of in Astana, Azerbaijan, that is creating a new school of medicine. And this is a need to develop new professionals in this country. And their connection to the education right now is actually something that is incredibly innovative. They're not seeing education as a building of just for doctors. Actually, this building is pretty much a brewing pot of a series of health sciences educational components. And you will see later on a little bit of how we develop the design for this project precisely for that. We're doing it very close by at University of Florida International University, where we are creating a campus, a whole health science district, completely dedicated to the education of health sciences and education of doctors and nurses. And it's actually growing exponentially. The more that we build, the more they need. So these are the kind of buildings that are actually hybrid buildings. They have about 3 or 4 colleges all in one, between public health, social work, medicine, nursing, to this one in particular, something that developed out of the needs that we see in our communities, which is the Extreme Event Institute, which is the effects of an extreme event in a society through healthcare, through social impact, economic impact, and actually, most importantly, sociological impact. University of Florida, I think Debbie mentioned it, actually through NIH and leveraging some of the money through NIH and their grants, we finished the CTRB, which is a Clinical Translational Research Building. This is where we have a collection of elements that really take healthcare and health education to the 21st century. We're talking about a building that is Platinum Plus. It's almost living building challenge. It's almost off the grid. It generates potentially its own energy through capturing the steam out of a cogen plant just a block away. It captures all its water. It has photovoltaics, very intelligent skins, and a garden that becomes not only a healing garden but a laboratory. And the idea behind this building was to actually create informatics about diseases and give that information across the world. So the Institute of Translational Research is in this building. The Institute of Aging is in this building. A lot of the pediatric research and healthcare for chance is in this building, as well as war rooms, where all of these individuals come together and they actually share their information and explore new ways of dealing with old and new diseases in the lifespan of an individual, from birth to death. And actually, most importantly, is where they're educating their new healthcare practitioners as well. The second point is that learning is not listening, learning is doing. And this one is very, very well known. Obviously, we're in academia here, but it's about team-based learning. It's about the idea that education, obviously, is changing. And the means of method of actually medical education is certainly a very fast-changing environment right now. We're talking about simulation. We're talking more and more emphasis on competency-based measurements, and most importantly, actually, individualized learning environments. The third point is education at the age of accountable care. Now, this one is actually really interesting. Shifts in healthcare policy are actually placing enormous pressure on the care of infrastructure. We all know that. A system of more focus or preserving wellness and treatment in outpatient and even virtual settings means that a continuum of care, patients' families will ultimately have more responsibility and require more information and more knowledge to train to help heal their loved ones. Now, this is important because when we're starting to design healthcare nowadays, we're not just designing for those health caregivers, but we're also designing for the families and for the extended family of a patient. For example, here we have a room that is actually for the siblings of patients in Miami Children's Hospital or Nicholas Children's Hospital, and it's called the Wonder Room. So we have a series of Wonder Rooms, one per floor, dedicated for all these siblings, the kids that are actually visiting their sick siblings, and what happens to their stress level, what happens to their psyche, what happens to their environment as they have to sit in a sterile lobby. Actually, let's help them feel less stressed, less emotional. Let's try to give them a moment of wonder and a moment of healing as well, and also education. So we're seeing how new programmatic criteria, new program areas are starting to emerge in our hospitals. Obviously, the fact that everything is connected, we have telemedicine, we have a series of, technology-based educational components as well as rooms, et cetera. Everything is pretty much trying to be flexible and adaptable. And as well, the fact that even when we have, and this is in the Spalding hospital that we have in Boston, that we just finished in Boston as a rehabilitation hospital, a lot of the victims of the Boston Marathon bomb were taken to the Spalding hospital here in Boston. And what was important was actually the fact that these rooms were not just filled with the victims, actually filled with the families of the victims. The families were being trained how to give exercises, how to rehabilitate, how to understand how to live with a victim or a family member that had been a victim, and their next stage in life, given their conditions. There's a hospital in Ghana, in Accra, and actually one of the most important things about this hospital, and one of the most important things that the client told us that we needed to really make sure we focused on, was the ability to bring not only families together, because sometimes they travel for days to get to the hospital, and when they get there, they actually need to learn a lot before they go back to their towns, but it's also, they're going to go through a process of a lot of stress and a lot of new environments and new situations. And so this hospital has become almost like a community center. It's almost a place for gathering and a place for learning. Not just a hospital. It's for mother and children. A lot of the education here is going to be concentrated on the well-being of mothers, birth rates, infant mortality, and of course, a lot of the new conditions that emerge now in countries in Africa, such as Ebola or malaria, etc. So we're dealing with this project, this hospital is now going to go into phase 2, is finishing phase 1 in August of this year, and it's going to be fully functional by the end of the year. Actually, the important thing about this is how transformational our teams, how transforming it was for our team and how transforming it was for us at Perkins & Will to actually delve into these kind of projects. One thing that I would say about this kind of healthcare design that we're doing across the world is that we're seeing actually, because we have to intersect certain things like the British code with the French code, with the USA code, we're seeing how we can leverage the best of all of the regulations across the world, sometimes to the benefit of patients and families that we rarely get to do sometimes here in the US. So it's actually not just us taking information to another country, it's actually bringing information from other countries to our system and to our designs here. Ultimately, the age of accountability, as I said, in terms of materiality and in terms of buildings of the next generation, is to really think that, there are toxins in the air, there are toxins in the materials that we utilize. We need to have this precautionary list be something that we always bring up at the beginning of each project and make sure that we're being knowledgeable and cognizant of what we're building and how is it affecting the human body. And team-based everything, as I mentioned, nowadays with technology, connectivity across the world, the fact that healthcare is no longer sort of this, the model of the physician as the autocratic decision maker and care provider. Nowadays, we're talking about teams of doctors and nurses and physicians and assistants and nutritionists and therapists and social workers and pharmacists that work together as a team-based care team. Health science education and health care is and has already responded to this by creating not only conditions in hospitals where you really see the dissolution sometimes of offices for doctors. Now they're actually hoteling in rooms where they can gather and they can talk and they can meet other practitioners. We're talking about you know, a lot more collaboration, a lot more integration, a lot more multidisciplinary or interdisciplinary care and education. And that's why we go back to the school in Nusam in Kazakhstan. And the ideas here were that they asked us, how can you bring everybody together? So we literally took a building and talked about the 2 hands of healing, and we talked about all of the different branches that we have to resolve healthcare, and we brought it together into a one space in the middle, and became sort of a symbol of their ideals and their vision of what healthcare is in their country, which is basically a team-based everything healthcare. They cannot just rely on the fact that doctors will be available. As a matter of fact, they have to rely on full teams to be part of the healthcare in their country. This is a building rendering and is under construction right now. And finally is, if health is the aim, obviously healthy materials and buildings is what the outcome should be. As we redefine healthcare to deliver wellness, attention has to be paid to the environment and to sustainability and to resiliency and to responsibility of buildings, and eliminating again a lot of these harmful materials and doing buildings that, again, that are more responsive like a human being is actually one of the confluences that we're seeing. The change of the US healthcare system, along with the deep concerns related with global health crisis, and increased awareness of the danger of the climate change, creates a health science medical educational landscape and a healthcare landscape that is transforming before our eyes. And we at our firm have to continue to push forward, and that's why when we look at buildings, we look at them like this. We look at them as diagrams of what is the health of this building? How is this building responding to its environment? How is it creating healthy environments? Where does the daylight need to be applied? Where doesn't it need to be applied? What kind of cooling systems or heating systems? What kind of alternative energy providers do we need to have? Where is it that we can create lungs for the buildings and strong bones for the buildings, and certainly a breathable environment so that we have less sick building conditions. Here in the Nicholas Children's Hospital, we did the same thing. We elevated the building, we let it breathe even from its belly. We created little secluded healing gardens in between some of the patient rooms. We created daylight transferring into most of the rooms, as well as some of the parents' gathering areas. And we studied very carefully sort of the wind patterns and the strengths and the compartmentalization of this building, so that we created not just this enormous system, but a series of ecosystems, if you will, that were interconnected with each other. These are some of the softwares that we're using with Revit and some of the BIM modeling software that we use, where we quickly start analyzing heat gain, daylighting effects, etc., across each of our buildings. This being the Stemple complex at FIU. Our design, the forms, the self-shading strategies, the kind of information we have to give back to the industry in terms of not only materials, but glass and structure and HVAC systems is what we're looking for, that our research and that our design actually propels this well-being in all of our buildings. We see it in our hospital in Rush in Chicago. You can see the incorporation of nature into a very tight urban environment, bringing that nature in public areas and in as many places that we could find nooks and crevices, not only for the practitioners to go out, but also for families or even the patients. In the Spalding Rehabilitation Hospital, which is located in front of the Boston Bay. And a lot of what we did here was that rehabilitation was not just about building it in the inside with all of our exercise rooms, etc., but it was also about the outside. So this park that actually surrounds and embraces the building actually is about the exercise routines that some of these patients have to do. It's about bringing that outdoor in so that you have this relationship with nature throughout your rehabilitation time frame, because sometimes it can be months, it could be a year, and you do need to have that relationship with the outdoors. So, as I said at the beginning, the day we saw healthcare design not as an expertise, but as a responsibility to better the human condition, and we found our soul, and we realized that everything was connected, that we all were interconnected, that no matter what, everything matters and everything is integrated. We found a lot of elements that we needed to bring into our designs, some of the examples being workplace and lifestyle trends that are, transforming our healthcare. You can see it here. These are the top 12 of maybe 25. Mobility, engagement, research, brand, culture, sustainability, wellness, globalization. This is the next generation of users, next generation of practitioners, and certainly patients. We're creating healthcare, and in this instance, some of the hospitals, this is Johns Hopkins and Rush and Spalding, community connections. We are engaging the community, we're bringing the community in, we're actually informing and educating. Hospitals are no longer this introverted type buildings or extroverted. We're going beyond ADA. We're really talking about what it is to make sure that it's not about just the code requirement, it's just what is the right thing to do for the conditions of some of these healthcare environments. It's about patient comfort and their families. It's about social support and education. Again, creating elements, as I said, new program elements like the, basketball court, libraries. Obviously, we have a lot of the chapels, but sometimes we have clients telling us, don't just create a lobby, just create this experience, this journey. You're kind of arriving at a sort of a small town USA, and you're not feeling that you're in this institution and you can't get out. Enhancing communication is important as well. It's one of the things that we're also bringing a lot into healthcare nowadays, and you'll hear there a lot from our other experts. It's not just education or communication amongst practitioners, it's actually this. This is the age of your handheld information. So if you're a family or a patient, imagine a kid. You can receive information, you can be connected, you can control actually the lights of your room, etc. And obviously you're going to hear also a lot about modularity, flex, and standards. The way we treat modularity is actually, we call it a kit of parts. We've been doing this in education, we've been doing this in science and technology, and it's some of the things that is starting to occur, and you're going to hear it from our experts as well in healthcare. Reducing the risk and error of patient safety, you're going to hear about too, and some of the things that obviously all the standardization does, but a lot of the things that we're also seeing is in K through 12 and higher ed, reducing the risk of students or kids, etc., or some really basic knowledge and really basic information that we're actually being able to implement into healthcare as well. So I will leave you with one thing. The mission as we see it today, and the mission as we are dreaming it for tomorrow. So for today at Perkins & Well, and I hope that we can inspire you to, is to continue to elevate the human condition, to be transformational, to create a next generation of healthy buildings, to bring wellness and well-being to everything you do, as architects and as designers,
to educate, and to design with soul and compassion. This is what healthcare teaches us designers. So today, as we know, we are bringing that nature in. We are understanding what is the best environment to be created for our patients and our families and our caregivers. We are seeing a transformation of healthcare design to a next century and a next generation, and not just through technology, but because our society is changing and our needs are changing. The tomorrow that we're dreaming, who knows? We'll see what comes. But for now, we're dreaming it in China. We're bringing new ways of doing things, learning from other countries, creating environments that we never thought would be part of a hospital or healthcare. You know, we're doing it in Africa. We're bringing the latest of what we know and who we are, and we're also learning about the latest of who they are and what we should be. And with that, thank you very much.